Okay, so we have here the AIDS epidemiology. So kindly look out in your PowerPoint. So HIV-1 is very common in North America, Sub-Saharan Africa, most countries. HIV-2 common in West Africa. The prevalence in the US very low for the HIV-2. Then we have here different mode of transmission, pattern transmission. Pattern 1 is very common among homosexuals. So that's same-sex, male to male, female to female. Very common in North and South America, Western Europe, Scandinavia, Australia, New Zealand. Pattern 2 is primarily transmitted by heterosexual contact, so male to female sexual contact. Common in Africa, Caribbean, South America. Pattern 3 is a combination of your homosexual and heterosexual. Okay, your HIV-2, on the other hand, this is endemic in the West Africa, low incidence rate in the US. And your HIV-2, on the other hand, is will have your lower, considered to be less infectious compared with your HIV-1 because HIV-2 will have your slower rate of the replication compared to your HIV-1. Okay, we have here the revised HIV classification and AIDS surveillance case definition. So before we go with that, okay, in 19, okay, so we have here the revised HIV classification and AIDS surveillance case definition. Okay, that's still in the PowerPoint. So, but before that, then this is the PowerPoint. That's the newer classification of your HIV based on the test result. So, but here in 1993, the CDC or the Centers for Disease Control and Prevention actually provides the guidelines here. The classification is based on the CD4 count of the patient and the clinical manifestation. We try to classify the HIV patient as either A1, A2, A3, B1, B2, B3, C1, C2. That's based on this criteria. But today, the newer classification is based on the primarily in the screening test and confirmatory test. Although we will be discussing later on the principle of this one. So the test for HIV could eventually be antibody testing. So you are detecting antibody directed towards your HIV antigens. So screening test for that, we have your ELISA, and confirmatory test, we have your Western blot for antibody testing. Another test is your molecular, so your PCR is being utilized for that. So based on that, we have here the revised HIV classification and AIDS surveillance case definition. So we consider here adult patients more than 18 months of age to be positive for the HIV for the following criteria. Number 1, positive ang patient natin na more than 18 months of age or adult patient if, number 1, the screening test is positive for both for antibody tests. Okay, that's both your screening test and the confirmatory tests are positive. Then number 2, the molecular test, the PCR is positive for that. Then we consider someone is positive for that if the patient is more than 18 months of age. Second criteria are those for mga patient less than 18 months of age. Then we consider them as positive if, number 1, definitive positive on 2 separate specimen. So, positive on 2 separate specimen, regardless kung anong test ang ginamit sa kanya. So, pas nabing positive on 2 separate specimen, so dalawang beses siya kinuha ng dugo, and both their tests here, whatever method it is, antibody or molecular, are both positive. Presumptive, then positive ang patient less than 18 months of age if only one specimen has been tested and positive siya for that. And thereafter, puro na lahat positive. Criteria number 3 is all about those mga children born out of the mother na infected, mean to say the mother is infected or HIV positive. Then, the baby, we could rule out them, considering them as negative for the following. Number 1, definitive. So, baby ay negative if at least 2 negative HIV antibody tests. So, either of this one, dalawang beses siyang nawalan ng blood using this method. Okay, and that has been tested after 6 months of age. Then, ang result ay negative, so the patient is negative. Or at least 2 negative HIV. So then, ginawa mo, dalawang beses mo siya kinuwanan, taken during after 1 month old and 4 months old age of the patient. Puro lahat negative, then you consider the baby as negative. For presumptive, 1 negative enzyme immunoassay test performed after 6 months, and thereafter, okay, negative lahat. Then, one negative HIV, this one, isa lang beses lang siya after 4 months. Negative naman, then thereafter ay negative pa din ang kanyang result, then we consider the baby as negative. Hindi siya na-infect. Category 4, on the other hand, are for those na, okay, mga baby na ang mother ay positive, then, so, pag nag-positive ang result nila sa criteria number 3, then you consider them as positive. Criteria number 3 is all to rule out kung negative ang baby. Criteria number 4, pag nag-positive sila, then they fall here number 4, I mean to say they are really positive for that. Okay, then we have here the signs and symptoms of the HIV. Starting here with during the initial infection, the patient would manifest flu-like symptoms, like the patient would have the fever, mga non-specific lang na signs symptoms, fever, sore throat, headache, night sweats, and we have also weight loss that could last here for 3 to 6 months. Then after that one, the patient undergo latency period where the patient don't have showing here any signs and symptoms, and the patient may eventually also give a negative result serological tests, and that's because the virus are not present in the bloodstream but the virus is in the tissues. And if left untreated pa din, hindi siya nagpa-test, hindi na-detect, then the patient would undergo here, or the patient would try to enter the AIDS-related complex. Pag nasa AIDS-related complex na siya, so again, magiging AIDS-related complex na ang patient natin if nagiging prone na siya sa mga opportunistic infections like tuberculosis or anything na madali siyang kapitan, nagiging immunodeficiency na ang patient natin. So we have that one for the ratio of your CD4 positive and your CD8 positive, your T helper versus your T cytotoxic. Normally, that's 2:1, madaming T helper natin compared to your T cytotoxic. But in the case of your HIV, the ratio is reversed. Dumadami ang T cytotoxic natin more than your CD4 positive. Okay, then we have here for the treatment. So, for the treatment, we are using antiretroviral drugs. So, antiretroviral drugs is basically not to kill the virus. It could not kill the virus. Only that it would basically try to inhibit the further replication of your viruses. So, these are the classification of our antiretroviral drugs. Okay, then we have here the laboratory assessment of the asymptomatic HIV patients. Okay, basically, so for the serological test, you need to repeat every 3 to 6 months interval, or even the CD4 count, the CBC count after 3 to 6 months interval. Just to monitor the patients. Okay, for the laboratory tests, we could divide laboratory testing here for HIV as we could have your CD4 count. We have also here the antigen testing, antibody testing, and molecular diagnostics. Antigen testing is being done, but then again, hindi ito ganun ka-diagnostic because again, ang antigen natin ay usually it's being produced on the earlier stage and most likely nagiging negative na ang patient natin pag tinest natin ito. So we are much of this one antibody testing. Okay, we'll be discussing each of the different principle of that. Test that we are performing for the HIV testing, we have here the CD4 count. So CD4 count, basically we have that count. So less than 200 cells per microliter of your CD4, the patient is already on the AIDS stage na. So immunocompetent, immunocompromised ang patient natin. So on the other hand, if the CD4 count here is already less than 350, then the patient should be advised to undergo already antiretroviral therapy. To count here the CD4, so the gold standard for that, we are using the flow cytometry. So procedure for that, we have here number 1, since you are detecting for the CD4 positive cells, which are your T lymphocytes, which are your WBC lymphocyte, then first you need to lyse your red blood cells. So in order for that, what remains in your sample here will only be your WBC. Next, you need to fix your WBC, specifically the lymphocyte, by addition of paraformaldehyde. Then you need to quantitate that one by your histogram. So para lang siyang para siyang CBC lang natin na nag-cell count tayo. Okay, another one, we have here your antibody testing. So, antibody testing, so we're detecting here for specific antibody. The screening test for that is your ELISA, enzyme-linked immunosorbent assay. Screening test lang ito because what you're detecting in the ELISA is the antibody to your HIV-1, antibody to your HIV-2, pero hindi siya nakaspecify kung anong klaseng antibody. So, pag nag-positive ka, you're just having the antibody to HIV-1, HIV-2, but you don't know what exactly ang antibody na present sa specific for that HIV antigens. Kaya nga tinawag lang siyang screening test. Okay, so procedure for that, since we're detecting for the antibody in the patient sample, okay, that one, then kailangan natin ng antigen as your reagent, which is your HIV antigen lysate. Then mag-a-add tayo ng anti-human globulin labeled with your enzyme substrate. Kaya nga tinawag siyang enzyme. This is your enzyme immunoassay. Then, you try to measure the activity of your enzyme labels. So, magbabind lang siya pag meron ka antigen-antibody complex. Ito say, pag positive ang patient natin ng antibody for HIV 1 or 2. Then after that one, try to measure the activity of your enzymes. And that's directly proportional. That would mean here na pag mataas ang activity ng enzyme, so the patient positive for that. Then we have here mga false positive and false negative. False negative. So, prior testing prior to seroconversion. So, nasa incubation period pa siya ang patient natin. So, do not expect na mag-positive na siya agad. Second one, the patient is in the immunosuppressive drugs. So, that try to suppress the production of the antibody. Third one, wala siyang antibody. It's because the patient is hypogammaglobulinemia, hindi siya produce ng antibody. Since we're detecting antibody, so wala kang makikita or madetect na antibody, so negative siya. False positive, so we have condition for that. Okay, the presence of autoreactive antibodies, also we have your severe hepatitis, could also result to false positive result.